So radiotherapy, what is that? No, this isn't it. Radiotherapy is a therapy using ionizing radiation, generally provided as part of cancer treatment to control or kill malignant cells, and is normally delivered by a linear accelerator. It may be also used as part of adjuvant therapy to prevent tumor recurrence after surgery to remove a primary malignant tumor, for example, early stages of breast cancer. Radiation therapy is synergetic with chemotherapy and has been used before, doing and after chemotherapy in susceptible cancers. A physician who practices in this subspecialty is called a radiation oncologist. Ionizing radiation works by damaging the DNA of cancerous tissue, leading to cellular death. To spare normal tissues, such as skin or organs, shaped radiation beams are aimed from several angles of exposure to intersect at the tumor, providing a much larger absorbed dose there than the surrounding healthy tissue. What it basically means is that you have to aim the ionizing radiation and not irradiate the healthy tissues. Otherwise, you would be causing more damage than you'd be helping. Of course, you're only going to use radiotherapy in specific circumstances. If a person catches a cold, for example, you're not going to blast their nose with ionizing radiation from cobalt-60 or whatever isotope. That'd just be not the best idea. So obviously, there are indications and contraindications for this procedure. The very first indication would be malignant tumors. For example, external beam radiation may shrink tumors to treat pain and other problems caused by the tumor, such as trouble breathing or loss of bowel and bladder control. Depending on the size of the tumor, how quickly it divides, and other characteristics, it may shrink over a long, extended period of time or a short one. For example, the median time for a prostate cancer tumor to shrink is about 18 months. So sometimes it may take a while before you know whether the radiation therapy has controlled the cancer or not. The second indication will be metastatic injuries. Findings from a clinical trial indicate that for some patients with peripheral sternal metastasis from advanced cancer, a type of precise, high-dose radiation therapy may be a highly effective way to relieve the pain. When cancer spreads from its original location, metastatic tumors can arise in many distant sites. Unfortunately, once cancer cells take up residence in the bone, pain can be a devastating side effect, as the growing tumor destroys the surrounding cells. For people who have metastatic tumors growing in the bones of the spine, the pain can be just unbearable. So, radiation therapy helps alleviate the pain. However, you must be very careful when shrinking these tumors because the spinal cord is just millimeters away and you don't want to irradiate that. However, it can't be applied for all metastatic tumors and only really affects small metastatic tumors, known as oligometastatic cancer. Another indication would be some relapsing benign tumors. For example, the brain tumors. While surgery is a common way to treat them, you're not going to operate a patient every time one relapses. So another way to deal with them would be radiotherapy. This non-cancerous brain tumor thankfully does not always grow back, however there's still a possibility. Another indication would be hemoblastosis, such as Hodgkin's disease, non-Hodgkin's malignant lymphomas, and multiple myeloma. For Hodgkin lymphoma, radiation therapy is given after chemotherapy, especially when there's a large or bulky tumor mass, usually in the chest. Radiation therapy or chemotherapy by themselves are not enough to cure this. However, both treatments work together very well. And of course, to balance the indications, we need to bring up the contraindications. The first one will be the tumor being far too close to the sensitive organs. Control the radiation as you might, it is sometimes impossible to target it without targeting sensitive and vital organs. Another fairly important contraindication will be pregnancy. The embryo is extremely radiosensitive and quite prone to mutations if it is irradiated. So it is very likely that it may develop some sort of disorders when forming, or it might just die after radiation therapy, so it's best not to administer it to pregnant people. Another very important contraindication would be irradiating the same part twice. You cannot administer the same treatment to the same part twice in this case. However, recent advances in diagnostic methods and radiotherapy now enable repeating radiotherapy with curative intent for the treatment of previously irradiated lesions. It all really depends on a multitude of factors, such as these ones. Another very important contraindication would be connective tissue disorders. Radiotherapy might trigger the onset of those diseases or make them worse by increasing the expression of self-antigens, diminishing regulatory T-cell activity, and activating effectors of innate immunity through toll-like receptor-dependent mechanisms, all of which could potentially lead to breaks of immune tolerance. Another fairly interesting contraindication would be a pre-existing lung disease that seems to hamper diffusion. Since radiation pneumonitis happens to some people after they received radiation treatments to their lung or chest area. So radiation treatment in this case could severely hamper the gas exchange within the lungs. If a patient has some sort of heart disease or some genetic heart disorder, then radiation therapy is not for them, since traditional and novel agents can damage the heart or peripheral blood vessels or cause problems with clotting or blood lipids. Another very interesting contraindication would be the patient not wanting to undertake that. They've probably heard about Chernobyl being bad and atomic bombs being very radioactive, and they think that this is not for them absolutely because they don't want to suffer acute radiation sickness. So it is the doctor's duty to inform the patient, tell them everything about the procedure itself, and if there's no other way, then look for other ways to treat an underlying disease.